Hello and welcome to you. A warm welcome indeed. Roy Noble here, and it's a great privilege and pleasure to be a Bevan Commissioner as we gather together for this auspicious occasion. Croeso cynnes i chi gyd, fel ni nawr wedi dod at ein gilydd fel casgliad arbennig am y diwrnod mae sy'n mynd i, wel, godi'r ysbryd, fi'n gobeithio. Something that will be uplifting. The showcase for the Adopt and Spread program, supporting adoption sites, Bevan exemplar innovation across Wales. Do you know, I've always been rather jealous of those who are innovators and creators in that kind of way. Does it come in a flash or does it gradually build in the mind? Somebody once told me that the world is divided into two kinds of people, those who do and those who get the credit for it. Actually, I believe that the world is divided into three kinds of people, those who make things happen, those who watch things happen, and those who merely ask, what's happening then? The bystanders. You really need the movers and the shakers and the doers and the makers. And the dreamers, of course. But the dreamers need the doers to put the rivets in the dreams so that those dreams will come to fruition and take you to that extra mile. You will find that the extra mile is never crowded, really. They do say that Humphrey Davy and Edison in stages produced the electric light bulb. But I bet you the extra mile saw that the man who invented the meter made all the money, don't you think? Now then, the Bevan Commission has been leading the National Adopt and Spread program across Wales over the last 18 months, building on the work over the last 5 years with the Bevan exemplar innovators indeed. And 15 of the Bevan exemplar innovators were selected to share their innovative work with a new site. Over 50 new adoption sites have taken on one of these great innovations, let me tell you. And over 150 people have been involved in the adoption spread of innovations right across Wales. Now, the work, you must remember, has taken place during COVID-19, and the participants have had to work exceptionally hard over and above the work they normally do, because all this is an extra for most of them. And they've had an impact on us all, and to ensure that we learn from the program and the ideas that they've actually come up with. Now then, there is a panel of project members with us today, and they participated in the Adopt and Spread program, and they have guests with them as well, so everyone is very, very welcome. And they will be ready to answer questions. And if you could put your questions in the chat box, the host will make sure that your question is asked, and hopefully that it is answered as well. So you're welcome again. So be prepared to be interested, to be enthralled, and to be inspired by what is on offer today. Diolch yn fawr I chi. Mwynhewch. Enjoy.
Hello and welcome to the Bevan Commission Adopt and Spread Innovation Showcase. Back in 2015, we set off with the Bevan Exemplar programme, and we found that across the NHS in Wales, there were many examples of fantastic innovation that we could develop and we could spread and share them across the NHS. But there was nothing in place to support people to do these things. There was nothing in place to support people to spread their innovation, and there was nothing in place, critically in this instance, to support people to adopt the innovation. Because whilst innovation is great and fun to do, the process of adopting the innovation is also great and fun, but it's quite hard work. So we set about with the Adopt and Spread Innovation Programme to help the adopters to adopt the innovation, to adapt it and to improve it to context. When we set out, we had 150 exemplar projects, and we asked them who was interested in joining the programme. About 50 of them said yes, and we supported those to try and find adoption sites. Through a process of elimination and people demonstrating interest in an application, we whittled that down to 15 projects that started off the blocks almost 18 months ago from today. Over that period of time, a couple of them have dropped off because of COVID, but 13 projects will join us over the next couple of days with 40 or more adoption sites to share their experiences of taking part in the programme, but most importantly, their experiences of delivering and supporting innovation adoption across the NHS in Wales. I think it's been a fantastic journey. I've really enjoyed it in the part that I've played. I think that the people you will hear from are absolutely inspirational, formidable agents for change and innovation across the NHS in Wales. And I'm hopeful, no, I'm sure that you will enjoy listening to their stories, and hopefully you will ask them questions to learn from their experiences. So I will hand you over to your host, who will take you through the rest of the day. Have a really great time.
You will have had the introduction from both Roy and Sean, and I'm the director of the Bevan Commission, and I'm going to be chairing this afternoon's session, which I'm sure you will find both interesting and inspiring. And I will pose the question that Roy posed at the beginning. I'll pose it at the end. Which are you? Are you one of those who make things happen? Are you one of those who watch, or are you one of those who just let others get on with it? I really hope you're one of the first and the foremost, and that we hope that you will take your learning and the insights you get from today's session forward. So today's session, really, we have three people. We have an exemplar, we have two other adoptees, all of which we can help you share. So we've got Debbie, Jane and Angela. And I'll ask them to introduce themselves in further details after. But in this part of the session, what we're going to do, we're going to get each of the panel members to reflect on the experiences they've had in this particular piece of work, and to understand really and share their journey with you. I'm going to pose the questions. If you have any other questions, then please also put it through the chat. But as we said, we started off with these were, and we have one of the exemplars here wanting to share her work across other parts in Wales. And both Jane and Angela stepped forward, and they were the ones that said, yes, we'd like to try it. So just to remind you, so we will be, if you like, sharing the exemplar experience, but also those people who adopted it. So in part one, we will be looking at that. In part two, we're going to have a short break with another short video, and then we'll come back and we'll really look at, and I guess throw out some of the conversation to you to understand what are the wider aspirations. Where do we go from here? Do we leave it as it is, or should we be seeing this kind of thing happen across across the whole of Wales? The question I will also pose for you all to consider throughout this is really the old adage of adopt or justify. The question is, why wouldn't you adopt something like this unless perhaps you've something better already there or something similar already there? And I think that's the question we need to ask ourselves. So without further ado, I'm going to ask, we're going to have a short video of each of the people presenting, a short video, and we will come back and I will be asking the panel members some further discussions and further questions. So over to the video, please. Thank you very much. Thanks for that, and hope you got the main key messages from those. I'm going to ask our, if you like, our panel to introduce themselves before I go into some of the specific questions here. But essentially, you got the gist of the program. You could see the impacts. Let's have the introductions from Jane, Angela, and hopefully Debbie when she can join us. She's having a bit of a problem at the moment. So over to Jane first. If you could introduce yourself, Jane, that would be great.
Okay. Oh, hi there. Thanks for joining today. So my name's Jane Spivey. I'm a dietitian within an R and Bevan Health Board, and I've also been involved with the Adopt and Spread programme within an R and Bevan.
Thanks, Jane. And Angela.
Hello, my name's Angela Cleaver. I'm a gastro-dietitian based at Landock Hospital in Cardiff and Vale, where we were one of the adoption sites for Debbie's initiative.
Okay, whilst Debbie is trying to join us, I'm going to go and ask Jane and Angela some key questions really. But I'm going to kick off, perhaps Jane, if you come in first on this one really. What made you really want to get involved in this? Why would you bother joining in something like this?
Well, I'm all for service improvement and development and innovation, and the Bevan Commission's ethos seemed to fit that bill, and having Debbie's initial pilot and the success of that as a kind of foundation for us to adopt and take this on and use this within our own service. It just seemed like a no-brainer, really. It was just exciting. It was an opportunity to use the funding from the Bevan Commission to implement sort of innovation, look at how we sort of can improve our service. So yeah, it was just a great opportunity and a great sort of, big learning curve, and some positives have come from it, really.
Okay, we'll come back to those in a moment. Angela, what about you? Because it's, it takes effort, and, it's that extra effort to put your hand up and say, oh, actually, I'm going to do that. What made you go for it?
So I've been a dietitian now for nearly 27 years, and I first started doing the low FODMAP diet for patients with IBS back in 2011, and I can easily say it's the biggest change in my professional career. It's made such an impact to the patients I've seen, bigger than absolutely anything else. And we've been trying to get it off the ground since then. And using the Bevan support seemed to be an ideal way to try and raise our voice. I think dietetics is quite a small profession, and we needed that support to be able to try and reach a wider audience. We know it works. We just need somebody to fund the service for us so that we can provide the best care for the patients that we see.
So it gave you that extra incentive and a little bit of resource to do that, really. And I think that's an important consideration. But, I think just having the ability to just say, actually, we want to make things better, I think is crucial. So how did, for instance, the Adopt and Spread project vary across the adoption sites? Jane, what were your approaches different? I assume they were. So would you just like to give us a little bit of insight, Jane, from and we'll come over to Angela later.
Okay, so from how mine varied really was, obviously we took it from Debbie's initial approach, which was targeting staff within CUMTAF Health Board and providing them with one-to-one IBS dietary advice and low FODMAP dietary advice. So within an R and Bevan, we sort of had to think about sort of how our service could adopt this, and we needed to factor time, resource, and sort of thinking of how we can maximise reach and access to the service. And we've had some really good results with group education in the past. So we thought we'll give it a whirl as plugging it as a virtual group education session as opposed to a one-to-one sort of conventional service. Obviously the pandemic played a part in that as well in relation to sort of access, and obviously our face-to-face consultations had dropped off at that point. So we were doing more virtual work. So yeah, it was a virtual group approach.
Okay, great. Okay, that's really interesting. And you mentioned quite rightly the pandemic. What a dreadful time to start any piece of work, you know, particularly a piece of work that was trying to look at adoption and spread when everybody's, if you like, energies were elsewhere as was appropriate. But, you know, from a Bevan Commission perspective, we learned a huge lot more. Angela, how did you take the approach in your area?
So originally we were hoping to mirror Debbie's staff project, as Jane did, but due to the pandemic, we had a very low uptake from staff, which is understandable. Because some of our community staff had been redeployed to the Dragon's Heart Hospital, there was a backlog developing of community patients who needed seeing. So we used the service to offer a service to those patients instead. So we actually provided more of a service to patients rather than staff, although some of them were staff members. And so that was done virtually because of COVID. So it gave us the opportunity to start using Attend Anywhere platforms and to develop a data secure way of emailing information to patients as well. So it's led to some significant changes in the way our service operates, which have been beneficial.
Yeah, it's fascinating, isn't it? Almost by default, two different areas, whether it was the pandemic or whether, you know, it would have happened that way anyway. Interesting how we all take this slightly different, or had to take a slightly different approach. But the important thing was that you actually did do the approach. You kept going and you found a way through it. And I know that the team have been very supportive in helping all of the projects do this. But in terms of some of, you know, the unexpected experiences for you as a team, how did you know, what was that? I mean, we were all going through unexpected experiences at the time. But in this particular piece of work, what was it that you know, that stood out for you? Jane, do you want to go first?
Yeah, it's like you said, the not so pink elephant in the room, the global pandemic. And obviously within and Bevan, we were in the middle of clinical futures as well. So our specialist critical care centre was opening up at the same time. So there was a lot of staffing changes, staffing pressures. For us, so when we launched it, we were thinking, oh gosh, like Angela said, the uptake's not going to be great. I think staff priorities are elsewhere. However, we were really pleasantly surprised by the amount of engagement from our sort of self-assessment and Eventbrite interactions. We had a high interest, over 100 people quite quickly were engaging with the service. And so much so we had to upgrade our survey account as it exceeded the number limit. So that was quite
amazing, isn't it? Who would have thought?
Right. However, the engagement and interaction didn't really follow through with the intervention. Unfortunately, registration numbers weren't very high, and then those who did register, the dropout rates were quite high as well. And again, perceived reasons, we just think it's to do, like I said, priorities changed, staff weren't as available to access it. The sessions were only available once a week. So again, in terms of staff being able to access, depending on their work and shift patterns, because this project was open to all staff within Bevan to improve their knowledge and symptoms of IBS. So there was lots of learning curves for us really, and sort of changes that we sort of had to make along the way. So yes, and obviously we've made adaptations going forward now of how we can improve access.
Absolutely, that's super. We'll come back to some of your adaptations later. Be intrigued on those. Angela, what about you? What was some of the unexpected experiences for both you and the team?
I don't think there's a huge much more to add than what Jane said. We did have a slightly higher rate of people not attending than we used to with our face-to-face clinics. I just wonder if that was a little bit of people forgetting that they'd made an appointment because they hadn't had to arrange so much time off work and had to think about how to get there. So although it was more convenient, it led to them perhaps forgetting the appointment. A lot of the patients were actually finding that their symptoms had reduced due to the pandemic, making them work at home, so they felt safer, they were nearer a toilet, and all of those sorts of things that they would normally have to consider weren't an issue. But otherwise, I think it played out as we would have expected to, given all the other issues of the pandemic.
So did you have to make any adaptations yourself? Was there, did you have to change things? I'll come back to Jane just to find out what she did, but I'm just interested whether often, when you're trying something, whether it's an intervention or in fact the adoption and spread or something, you've got to change it to your circumstances. I mean, not just COVID, but local circumstances.
No, the biggest change I think was not being a staff service and running it as a patient service, and then being able to use email as a way of getting patients' food and symptom diaries in and getting information out to them. So that was a big change for us, but it's something that's worked very well. And that was something that we'd always wanted to do, and the pandemic enabled us to be able to do it. So there was some positives from it.
And presumably, you will continue to learn and build on that. I'm assuming.
Yes. Now we've got that. There's no reason to lose it. Yeah. And things like Attend Anywhere has been a very useful platform for seeing patients, and that does make a difference, being able to see somebody rather than just being on the telephone.
So I'm going to stick with you really, Angela, and ask you just about some of the benefits that you've shown from the Adopt and Spread programme. What are the benefits to the NHS? Was there cost? What was the impact on waiting? What did what were you able to sort of, log and collate and, to use really as a means to say, well, actually, this really is beneficial?
I think the biggest change will be if this is adopted in the future. So what we would like to happen is for dietetics to be more of a first point of contact from a GP rather than us being at the end of the process, so that we can avoid costs. So a lot of people have come to us having had unnecessary investigations. They've been on waiting lists for a long time. They're already on medication that, whilst they admit probably doesn't really seem to be doing much, they don't want to let go of. Whereas if they saw us first before they were put on it, then we could avoid those costs, avoid people being referred into secondary care. So I think we need that. We need to be put in at a different place in the pathway. At the moment, we're at the bottom, and I think we'd be better if we could go in at the front.
And it really does illustrate easy access, early access. Both of those parameters. Yeah. In other words, you don't need to go through the system, but also here's a very easy way in which you can link in. And all of those are also very powerful for the individual in terms of time saved, effort, all of that. And I think sometimes we fail to see that. We often expect patients to fit into the system we've got. And in the past, we've always fitted into the system that's evolved. And I think what this does really is, through Debbie's work, where she kind of had a go at it, we're then actually saying, well, how might this really work in other areas? And those are the things I think you're highlighting, that particularly that it makes it easier for that earlier access to allied health professionals, and in this case, yourselves, really, dietitians. Jane, I'm going to come back to you and just ask about the adaptations you made, and then also the question just linked with Angela there about those benefits, because it's everybody looks for the benefits, and being able to illustrate those is really powerful.
Yeah, so with our service, the staff were able to self-refer into the service through a link through the employee wellbeing intranet webpage, and from that then they were able to complete a self-assessment. And this helped rule out whether or not they had any red flag symptoms that aren't suggestive of IBS. So IBS symptoms can be similar to other diseases and conditions that need to be investigated. So we would signpost those people to their GP and for further online information and resources. initially, the ones who were showing red flags, we were actually excluding them because we didn't want to mislead them by bringing them into a session on IBS when they could have had another disease condition that needed to be addressed. But with our uptake being small to start with, it was making our numbers even less. So we modified that to not exclude people. We continued to signpost them to the GP if they did have red flag symptoms and give them additional information, but they were allowed to register onto the programme. So that was the first modification we made to improve uptake. Mm-hmm. And then it was recognising then access then that one session a week, knowing that staff across the health board work varying shifts, particularly nursing, trying to get that time out. We were thinking, okay, this is quite limited, and obviously this was just down to the resource of my availability really. So we looked at, we're now in a position where we've created an online resource, an on-demand webinar. So we've actually pre-recorded the presentation. Yeah. We've also involved clinical nurse specialist input as well to make it a bit more holistic. Just taken away that kind of time restriction really. So it's a resource that's open, that staff can access at any time, in the comfort of their own home, in the workplace. And that's something that we're still very much evaluating and reviewing. So some quite significant changes along the way.
Well, and it's fascinating, isn't it, that, circumstances, particularly extreme circumstances as we've been in, pushed you to adapt. And to be honest, it's a bit of an obvious one, isn't it? If you record something, anybody can access it at any time of day. And when you are in work and you've got particular shifts and you've got particular demands, that makes eminent sense. So I'm assuming that presumably you can, you will continue to build and monitor what's happening in that particular context. And just going back to the question I posed to Angela really, which was the one, the benefits. I mean, this was interesting. It was obviously related to staff. And, inevitably there were obviously some issues there, but you were trialing with that. Did you particularly pick up on any particular specific benefits to your staff?
I think the numbers are so small, unfortunately, we can't sort of draw any firm conclusions. We were hoping that we would mirror what Debbie had represented in her previous pilot with staff in terms of cost savings in relation to medicine management, reduced sickness absences. So from the data that I was able to collect, we did demonstrate symptom improvement with the very small number of people that we did do intervention with. However, from a sort of health board and service and cost side of things, we now have a product actually that is running and sort of there's very little resource and cost that needs to be put into it. So it's an online resource that staff can access, and they're still getting that benefit potentially is what they would have got if they'd have seen me face to face in a live webinar. So
it's really interesting. Now, I was just going to ask each of you really, would you ever consider swapping in the sense of, or adapting, so that Angela, you look at it on the back of your staff and staff involvement, and Jane, you look at it then as opening up to the public, because almost by default here we've got two separate approaches, which is fantastic. And I just, Angela, if I can come over to you and just is there something you could easily, presumably you could easily do that, take the video, make it, really easy.
It's an easy win, isn't it? Yeah. I think the one thing though that really makes a difference is the dietetic element. So I do think, especially with patients who perhaps don't have the same health literacy as some of our staff members may do, they really do benefit from somebody explaining their diagnosis of IBS, of explaining the healthy eating even information. I think we overestimate people's ability to understand and implement those changes without having it explained to them in relation to their individual circumstances. And one of the things we picked up from the patients we were seeing was that 55% of them had tried to do the low FODMAP diet on their own and had failed. And they'd just been given a leaflet or told to have a look online or watch a webinar, and they hadn't managed to do it. So I still think whilst they're useful, there is a role for people to actually be able to access that one-to-one support from a registered dietitian. I think that's our real benefit. And maybe it's a bit of a combination, actually. Maybe there's a bit of, self-management, and then so actually there maybe is something in between, and, whereby you're actually doing that. Jane, do you see yourself adopting this widespread for your patients?
Yeah, going forward, certainly I've had discussions with our gastroenterology lead, and she agrees, or dietetic gastroenterology lead, should I say, and she agrees that this would be an excellent resource for public. And as Angela said, I think more so probably for first line advice, IBS advice, with low FODMAP diet recommendations. If first line doesn't work for that individual, low FODMAP can be a very sort of complicated diet to follow and to comprehend. So I agree. Maybe that's if all our kind of if all our first, I don't know, if this can help reduce sort of the need for first line intervention one-to-one, maybe we can put more resource into sort of a low FODMAP approach then. Yeah, provide dietetic input, as Angela said. I agree. That's where our skills and our knowledge and our role comes across really with low FODMAP.
And presumably, it offers the opportunity to just vary and do, self group, have groups meet themselves so they can help each other, all of that thing. And it's really quite exciting, and I think really, really important. Deborah, welcome to the session. I'm really pleased you've been able to join us. We're having a bit of a problem hearing you at the moment. Is there anything, would you like to be able to either turn the video off or something? I'm just trying to see, is there anything you can do? We can't hear you at the moment, Deb. Oh. Have we got you? Deborah, are you there? Right, I tell you what I'm going to do. Deb's obviously got a bit of a problem at the moment, and I can see they've been trying to get her in. I'm just going to just have one last question, really, for Angela and Jane, and then we're going to go into a very short video. But the very last question really is in terms of your this is about IBS. This is a system that is specific to IBS. I'm just wondering how and in what ways the principle might be able to be applied to other areas, either that you work with or that may be outside of IBS totally. So I think you can apply it to any area of dietetics, really, can't you? The developing webinars and information, or as we said, using online platforms like Attend Anywhere. It goes across the board. Jane, and can you see its wider application?
I agree, definitely. And I think particularly thinking about sort of staff well-being and employee well-being, it's definitely a route like diet and lifestyle play such a big part in health and well-being. I think there's more than just sort of IBS. We could even consider diabetes. We could even just consider heart health. I think there's a whole array of conditions that we could provide information through this, like Andrew said, through webinars or information and resources online to empower people to self-manage their condition.
That's absolutely right, and I think we're at the cusp of something here. I'm going to try Deb one more time just to see if she can come in. Deb, can you take your off? Right. Are you with us, Deb? Okay. She is in person, but not in voice, Deb. We can't hear you. And it must be incredibly frustrating for you. But what I'm going to do, we've got another short video to bring in, and then we're going to open up the panel to some wider discussion. But if Deb, you're joining us, I'll come back to you at the beginning just after this video. So can we bring in the next video then, and we'll see if we can come back to Deb after this. Over to the have a look at the wider aspects of the programme. That will have given you an insight. For those of you attending this particular session, you can see that much more around that range of projects and interventions that we've been testing out during the last 12 months or so. And please encourage you to dip into some of the others, but also to encourage and share with friends. This is we're at a really particularly important stage, I think, in the health and system across Wales. We've had a massive jolt in the recent 12, 18 months. Whilst it's been horrendous in many respects, in most respects, we shouldn't let go of the real positives and some of the opportunities that have come out of this. And that's what I would really encourage all of you here that are listening to us today to do. It's really, really important that we don't just revert back to normal. I know that's been said so time and time again, but unless we can build on, and this is why this work, the Adopt and Spread work, is so very timely. It's survived, if you like, a real significant trauma in everybody's way of working, but in doing so provided a real opportunity, if you like, to try out things differently. And the timeliness of projects like this coming together is really, really important. So, you know, I go back to my, I guess, question at the beginning. It's about the adoption or justification of something that, you know, is really, we see as a real opportunity. So I think Deb is still having problems joining us. Deb, are you there? Are you? No, I think she's still having problems. So I'm going to move on to the sort of second part of this. So we've heard the specifics. We've heard how Jane used it particularly with staff. We've used how Angela used it particularly with that wider, you know, patients. We've heard the adaptations that both of them will have had to have made in order to make it work. We've also heard some of the issues around numbers and various things, and we touched on some of the real wider issues around the impact. So I'm going to just move on really, and I'm going to ask some of the, you know, the big, you know, the question really, what do you think is next for projects in your area or in Wales as a whole? Presumably, Jane, you've got colleagues who also deal with IBS, whether it's for staff or for patients. What is it we can do to, you know, if you like, what's next for Wales? What do we do with this?
I think, like I said, I've touched on earlier, really, that, like I said, we're still very much learning. Like we've got this online resource, this on-demand webinar now. We need to see what the effect of that is. So we are evaluating that, and then, like I said, looking to roll it out to then public. Whether or not it be like a first line approach for our patients who have been referred of IBS, but certainly, like, having worked now with the Bevan Commission and having had this opportunity, it's really sort of opened our eyes to sort of innovation. Anything's possible. We've been forced to think outside of the box. So certainly I would recommend anyone who wants to consider change or service improvement to factor the Bevan Commission, really, to take projects like this forward. And as you said as well, it is transferable to other conditions as well that we all live with, staff and patients, that, like I said, we can promote sort of self-management and empowerment to best manage that condition.
And I think in truth, I think what you were touching on there, Jane, forgive me if I'm putting words in your mouth, but there's an element of courage, really, when you have a go at something that's different and you don't know whether it's going to work. You know, that kind of sticking your head above the parapet. And that applies both in the adoption of things as well as in the initial testing of those. So there's that courage, there's that competence, really. Gosh, am I going to do that? Have I got any support? So, you know, being not quite hung out to dry, but it can feel a bit whatever. And I guess there's sort of competency, really, a bit of skill. So I'm just wondering what support you had, you know, from your managers and your team. You know, what were you out there on a limb or what?
Not at all, but I'm glad you made that point that like in the middle of a pandemic, starting a project, and when the uptake isn't great, it is really disheartening, and it's hard to sort of, well, you've got to keep motivated, you've got to keep going, but you do have moments of, oh gosh, how's this going to end? So for me, it's just literally drawing upon other people's experiences. So from just meeting with Debbie and Angela and the Bevan Commission, they really helped me sort of overcome barriers and problem solving. Even within my own health board, I was literally, I think I'm on a red list, is it, for IT and communications, because I was constantly asking them, can you recommend this platform, or can we use this resource? Because obviously we had the limitations of our sort of health board, cyber security and firewalls as well that I had to overcome. Linking with employee well-being as well, looking at what they've done as well, because obviously it's targeting staff, so they give us some really good pointers, and they were kind enough to host our project on their intranet page as a route for staff to get into. Learning from other staff, so we were fortunate to get a clinical nurse specialist who saw it advertised and wanted to be involved.
That's great.
So it was a collaboration opportunity. We had an excellent dietetic assistant practitioner, Patrick Neal. His ability to sort of adapt and take on board new technology and implement my vision, he played a big part in that. So
so go out there and find those champions that will help you. That's a key message here. That there are people out there who are willing to help and also quite enthusiastic along the way. And perhaps the significance of finding one who's really got a brain, if you like, that will support you. Yeah, absolutely. What about you, Angela? What about you? What support did you have, and were you able to, draw upon support in that sense, and in terms of, the what and where next, really?
So yes, I've had support from my head of service, from Judith Jenkins, from my manager Jo Jeffords, obviously from Jane and Debbie along the way, and from the Bevan workshops that we've been on. But I think one of the unsung heroes is our admin team, who are worth their weight in gold in terms of setting clinics up. They're the ones often dealing with patients over the phone, making appointments, all of that sort of thing, and helping day-to-day tech problems instead of joining the queue on for our IT, as just Jane has alluded to. So yes, it takes a lot of people in the background to help get these things off the ground.
And I think, you know, often we think we're the only ones, you know, we're the ones responsible, or we're the ones with the expertise. We at the Commission talk about co-production. You know, this can only, you know, very often the success of things are down to other people are making equal contributions in very different ways. I'm just going to check to see if Deborah is with us. Deborah, can you speak to us?
Oh.
No, Deb, we can't hear you. Unfortunately, we can see you. I don't know whether, can you take off your ear? Would it be better without your? Can you do it without that or not? I don't know. I'm thinking of a solution. At the moment, we can't. No. But Deb, as and when you do, just if you know, just remind us if you can get through. I'm going to come back to Angela then in the meantime and ask Angela a question really, which is if there's dietitians and others in the audience listening to this, what's your recommendation for if they were now thinking, oh, I'd quite like to introduce this, but where do I start? What do I do? What's your recommendations to them?
Do it.
Oh, lovely.
It's, as I said, yes. FODMAP especially made the biggest change to my practice in years. It's something that really does work. It's so satisfying to be able to make such a change to patients. It really does change their lives, and you can't do better than that. So go out there, see if you can get the support. I mean, that's what we really need is funding and training for dietitians across Wales to be able to keep delivering this service.
So where might that, you know, let's say they're saying, well, that's all well and good, but I haven't. So where do I go? What, you know, I'm sitting here, I'd really like to do this. What could they do? Where, you know, at the end of the day, do they have to sit and wait for funding? Is there something else they can do? Can they come and talk to you guys? And, you know, what in practice, what could they really do? And they say, I'm really interested in doing this.
I think any of us would be happy to have a chat with anybody who's interested, especially in terms of imparting knowledge. That's the easy bit. I would say most dietitians have got the skills to be able to deliver it. It's just understanding some of the intricacies involved.
And presumably they could also learn from some of the issues that you've had to deal with on the IT and the admin side. So sometimes the resources are within the system. It's just about perhaps accessing them.
Mm-hmm. Yeah, I think especially now because of COVID, we've actually got systems that we didn't have before, like Attend Anywhere, that are improving patients' access to us without them having to make a trip to the hospital.
Yeah, and that's really important. And the Commission's been looking very closely at how and in what ways, what services we can be taking out of acute care into communities closer to home, whether it's leisure centres, whether it's on the high street or whatever. And it was certainly a big issue in our report, which is due to be published shortly in the next couple of weeks. But in that report, what we identified was particularly around what you've just described, was the direct access to allied health professionals in the community, as opposed to going through a referral system through into the Zoom. So Jane, in terms of your recommendations, if people are, you know, colleagues are listening here, what would you say to them? And you know, it's all well and good saying, oh, well, yes, you had some money to test it, but you had this. But if you're out there and you're saying, well, okay, where do I go? Do they contact you both, or you, Deborah, or do they, you know, what should they do?
Yeah, definitely. Well, like I said, I can't recommend the Bevan Commission enough in terms of the support that they gave me and sort of helped my idea come to fruition. You've certainly got to be very creative, think outside the box, but also don't reinvent the wheel. So I took inspiration from other sort of good examples of sort of innovative practice. So the NHS Somerset patient webinars come to mind for me, that they've got the dietetic service of an excellent resource, and that's something that I know we can call upon should we need to update our resources? That's something that we could reference. So there's already really good things out there. It's just finding a way to kind of get your patient group or your staff group to sort of know where that information is, raising awareness. So using technology where possible. There's I come across lots of sort of free trials of things, like survey platforms, and obviously utilising video conferencing, things like Teams and things like that. And yeah, just collaborating really, and learning from people, the good, the bad and the ugly. I think like the good thing about the Bevan Commission is that we can be quite transparent, because for me I was quite hung up on the numbers, that our numbers weren't great. However, it's been more of a process for us, that we're still very much evolving the product and we've got it to a point now where we think it's good enough to run on its own, and there isn't actually any cost associated with it. We've just got to make sure it's kept up to date.
So a lot of what you're talking about is around the ability to set things up and get things going, when in truth you've got that now, and and actually there's no reason why somebody else shouldn't just say, oh, can I just have a look at what you got? Can I put my IT guy with yours? Can I talk to your admin, or whatever it is? Actually, why wouldn't you? So where are you going next, Jane? What's your, we're now looking at recovery, COVID recovery, we're looking at sustainable recovery, we're looking at all those areas. What is Jane going to do next with this?
What am I going to do next? Oh gosh. Well, obviously for me, the Staff IBS project it's not come to an end. It's been handed over now to continue monitoring and reviewing the progress. Oh, gosh. The world is my oyster really at the minute, I guess, in terms of project work. My role's sort of changed quite a bit as a result of the pandemic. There has been job changes, and yes, I'm not really sure yet. I'm trying to think in terms of where I'm going to go. I'm particularly interested in oncology, and I have been involved in other projects similar to this really, where it's empowering the patient to self-assess their needs and then be able to guide them or signpost them to the best advice possible for that issue, may it be an online resource or a referral to the dietitian. So self-referral is really interesting at the minute, I think. Looking at how patients, we know if patients are self-referring, they're going to be more motivated to want to engage in intervention. So yeah, I think dietetics.
So watch this space, and presumably you can take some of the, the approaches that Angela has used within, with the public, and really blow that open. Angela, what's for you really? What's the big thing that where next for you, and how will you build on this?
So without the funding that we've had for this, we know we can't carry on providing the service that we have provided for this over this last year. So we're looking at working with community dietetics to go back to an online group for first line advice for patients, and obviously we've got the resources that Jane's developed that may well be useful for those patients. I think as I said before, what I'd like to see is dietetics as a first point of contact in primary care. So that would be a big leap, but that's where I would like to see us, so that patients don't have to go through all those hoops through the GP, through getting costly investigations. So that's what I would like to work on.
Fantastic. I got one last question for you guys then, really, and it's really around, if you go back to your finance director or your chief executive, really, about the importance of this approach and what it has to offer, so the potential still to come. What would you say, Jane? What would you say? It's a standard thing. You get the opportunity and you meet him in a lift, isn't it? That's what they say. You got a minute or something to convince somebody or something. What would you be saying, Jane?
Well, first of all, dietitians are really important for the management of IBS and the improvement in symptoms and quality of life and well-being for people living with IBS. We know from Debbie's original project that there are cost savings associated with it from a medicine management point of view, and reduction in sickness as well. So that's not just within the NHS, that can be in relation to other organisations as well. We know that there are ways that we can do it where there isn't necessarily a big cost implication, and that can just be as effective. So just bigging up things like the Bevan Commission, really, to support innovation like this, because actually, like you said, through default we can find better ways and cheaper ways and just as effective ways of doing things.
Yeah. And Angela, over to you then.
I think I'd just keep it really simple and just say we can save you money.
Oh, that would definitely keep the lights on. Yeah, absolutely. Well, and obviously, and I think you're right. You can, there are much, what you're suggesting is there's a much more efficient way of doing this, and it also has benefits to the patients as well. Yeah. So this is huge. This is really, really powerful. So, thank you both very, very much, not only for joining in this session, for your endurance and your commitment during the last 12 and 18 months. It is hard. It is hard to be an innovator. It's hard to be an adopter, because then you're taking somebody else's idea with the support of somebody such as Debbie. And it's really unfortunate we've not been able to see and hear from Debbie today. But I'd just like to say a huge thank you for Debbie. Not only has she been a great ambassador for our exemplars and, fantastic doing that piece of work in the first instance, she's also been very patient and supportive, and everything you could have wished around somebody who was going to say, who wants to adopt my idea? And it's fantastic. So, thank you, Deb. I'm really, really sorry that you've not been able to join into the conversation, but thank you so much for all the things that you've given. And I'm going to suggest also that if people want to get in touch with you, I'm sure you'd be really happy just to help out. And I think some of those things were around really the need to change from a very traditional approach to diagnosis and treatment, not only around IBS but around others, really, and really, that whole origins of the IBS FODMAP, which we're incredibly grateful to Deborah for. So if anybody's got any specific information that they'd like from either of you, I'm going to volunteer all of you. Please contact Jane, Angela, and Deb. In fact, it would be a fantastic one to write up this as a conglomerate, because what we've got are various experiences. So that's something I'd throw back to you. It's a lovely publication here, I think. And I would encourage you, before everything else takes over, I would encourage you to go away and really make the most of that. But may I say then, perhaps before we close off here, may I say a couple of just closing remarks here. One is really, we at the Bevan Commission have recognised that for whatever reason, allied health professionals, therapists, are incredibly creative, and they're also really brave, because many of them, we have a huge amount who step forward and come forward and offer themselves to do something innovative. So not only are they brave, they're quite creative. They've got creative minds, and we recognised this recently when we were talking with Ruth Crowder, the therapies advisor at Welsh Government, and arising from that, we were talking about the adoption. And we were talking also about, so why is it that people just don't grab other people's ideas and take them? But we recognise the numbers, and we, over the last 2 or 3 cohorts, we recognised we had in the region of 29 therapy exemplar projects. And as a result of those conversations, we have agreed to do 2 things. One is we will be hosting jointly with Welsh Government, a therapies only showcase on the 23rd of September. So you two don't go anywhere. You know, the adopters as well as the exemplars, we will be calling on you. That's really important. So, and that event will showcase all of these ideas we've had over the last, 2 or 3 years, because there is no point in developing great ideas if we don't do anything with them. Absolutely no point. Sometimes even within health boards, they stay in little pockets when they could, even spreading within your own health board can be challenging. So for us, the need to, so we're going to do two things. We're going to have this showcase. We're going to involve all of the standardized committee structures and systems that supports allied health professionals and their work. And they are going to be working jointly with us to, first of all, make people across Wales aware of these really, really great ideas. And secondly, to work with us to ensure, and all of you, that these are not only, people are made aware of them, they are encouraged and supported to be adopted across Wales. So we see that as a really, really important step forward. So note for your diary, 23rd of September, we'll be looking across the range. There are other dietetic projects. There are other wider OTs, speech therapists, podiatrists, you name it. We've got a range there. So if you could spread the word, that is the date. If you could encourage others to come, it would be fantastic. And if you have an interest in the meantime and you want to talk to Jane, Angela, Deb, or the Bevan Commission itself, please do so. We would be really, really encouraged. And one last point, we are about to open our next call for Bevan exemplars. So for those of you who are listening and for those who are participating, we would encourage you to think about these ideas. Sign up. In the next couple of weeks, we're expecting, we've already tweeted some of the details that'll be coming out later this week with a view that there's normally an 8-week period whereby we would encourage you to just put your ideas forward. There is a process it goes through. We encourage people to go through, but put your ideas, have some thoughts, and as I say, work with us over the next 12 months to really push the boundaries. And that's exactly what we want to do in Wales. We are punching above our weight here. We are ahead of the game in terms of adoption and spread. I think we're also ahead of the game with the amount of ideas and great ideas that we see. If we can translate, and between us, if we can all translate those ideas into practice, we really in Wales could stand an incredible chance of really being a global leader in terms of what we're doing. So go out, spread the word. Please encourage, if it's not you, encourage others that you know. Spread it in your departments, in your health boards. Please do that. And the other thing is keep in touch with us on our website. And I suppose the challenge back to you then before you leave really is two things really. One, adopt or justify. So if you're not adopting, you have to justify why you're not adopting. And I take you back to the opening remarks by Roy, which were, I thought, also very thought-provoking. Made up of 3 kinds of people. Decide which one you are. Are you the one that makes things happen? Are you the one that watches things happen? Are you the one who leaves it to everyone else? With that closing remark, can I just, on behalf of the Bevan Commission, thank all of you who have stayed with us and have listened to our panelists today. Can I thank you for joining us? Can I also thank Angela, Jane and Deb? Poor Deb, I bet she's as frustrated as anything. We all feel really sorry for Deb. I mean, she was the start of this. So can I say a really big thank you? And we've got one final video just to round things off. Thank you very much, everyone, for your time.
Thank you.
Thank you.